One of the challenges we have in the Parkinson world is to provide a more uniform evaluation of patients. In the early stages, diagnosis still relies on symptom manifestations, which are generally within a year recognized by the largest majority of neurologists or geriatricians. But as disease progresses, people start developing fluctuations in their clinical state. These changes in the clinical state that we call wearing off or motor complications are not easily recognized. One reason is that people with Parkinson tend to go to the office of the doctor when they are on the effect of medications. Also, the doctors are not aware or don't ask specific questions to ask patients if they experience this phenomena during the day, or maybe, for instance, if late in the afternoon they feel some slowness, some rigidity, some tremor coming up, or maybe early in the morning before they take the first tablet. So in order to provide a more uniform assessment, we have developed a tool which we call ManagePD. The ManagePD tool is very simple. It can be tested online at managepd.com. You can find it easily. Basically, it has been developed together with the patient association in order to ask questions that are meaningful to the patients. It has been tested by several hundreds of neurologists, and now it's available for everyone. And essentially, you go through very simple questions in order to understand if your patient in that condition falls into three scenarios. One is your patient is well optimized in the treatment, doesn't require any adjustment. Two, your patient is not well optimized, but maybe you should adjust medications. Third category, your patient is not optimized. You have already tested available medications. Consider this patient for device-aided therapies, maybe surgical or infusions. As the number of these therapies becomes greater, so we have more options, more infusion strategies, several surgical opportunities, then it is important to identify these patients early rather than late and make it more uniformly across the medical community.